protest in a way that doesn't lead to loss of life, but in fact enhances life, and in fact enhances power and enhances our rights. And I would like to make this point as well, that although the subject of our discussion today is the right to protest and the right of access to healthcare services, all of the speakers before me have recognized that that is not the only cause that denies people their rights when it comes to health. In fact, it's a relatively minor cause of denial, but I don't want you to take comfort when I say it's relatively minor. I'll talk about that in a second. But there are other factors, colleagues from the Human Rights Commission, you are aware of. Corruption in the healthcare services denies people access to healthcare services and causes loss of life. Mismanagement in healthcare services denies people access to healthcare services. The chronic underfunding of parts of the healthcare system, and particularly parts of the healthcare system where people are least able to protest, and where they therefore most need our voices. People with mental illnesses, chronically underfunded. Right of access to children, chronically underfunded. The comrade from Denosa says there's no minimum service level agreement. He's right. But you could also protest that why is it that 20-something years after the Constitution was brought into effect, that we don't have a definition of basic healthcare services for children? What is a basic healthcare service to which a child is fully entitled today as we sit here?